Welcome to Eye on You. Edward, this has been a tough year. All of our lives has changed, and there are various measures to combat with coronavirus. How are we going to evaluate the effectiveness of these measures? So far, we have only vaccinated around 30% of our population, which the vaccination rate is much lower than UK and US. Should the government develop an effective strategic plan to counter vaccine hesitancy? Also, it is the fact that there is currently a shortage of doctors in Hong Kong. Therefore, there is a proposal as to attract more qualified, non-locally trained Hong Kong doctors to practice in public healthcare institutions in order to expand our pool of doctors in Hong Kong.
Today, we are very honored to have a very special guest with us. While he served as the Secretary for the Food and Health Bureau, he was very popular and got a very high approval rate. Our special guest is Dr. Koh Wing Man. Besides served as the Secretary for the Food and Health Bureau, he was also the Chief Executive of the Hospital Authority. He is now a member of the CPPCC and a private practitioner.
Hello, Dr. Koh.
Hello.
Welcome to our show.
Welcome to our show.
Hello.
In regarding the current coronavirus measures in Hong Kong, how would you describe the effectiveness of these measures?
I think we must look at the history of Hong Kong in combating serious infectious disease challenges. Since the SARS epidemic in 2003, I think both the Hong Kong government as well as the community and the citizens have learned a very tough lesson. That's why ever since that time, we have taken a lot of measures to improve our infection control facilities, our stock of supply for personal protective equipments, as well as trained up a lot of infection disease control related professionals. And the Hong Kong citizens also have gained a high level of knowledge about how to protect themselves, as well as a perspective of infection control, such as social distancing measures and how to use the mask, etc. And that's why since the outbreak, you have not found Hong Kong government using very extreme measures like curfew, like a complete stoppage of external travel arrangement. Instead, we have been using we have been sticking closely to internationally regarded public health measures, and that is we provide the facilities to have rapid tests for all suspected patients, and sometimes we also conducted mandatory testing to certain population. And then we provide the facilities to isolate all those who have been diagnosed as a confirmed case of COVID. And furthermore, we do very thorough contact tracing. And also the government is taking very meticulous approach in having a risk assessment for different types of facilities and premises, so as to have a very balanced measures. On the one hand, to have effective control of the spreading of the epidemic, as well as allowing a certain degree of normal social activities and economic activities to go on. And so far we have been containing the scale of epidemic to a reasonable size. So I think that although there are many criticisms against the government in terms of the various measures affecting economic activities and social life, I think overall we are not doing that bad.
If we look at the situation in Hong Kong, a vaccine hesitancy is a major problem that we are facing. And we believe that this is a problem that shall be well addressed. In your opinion, what does the government have to do to counter vaccine hesitancy?
I think it has to be rather forceful measures. Firstly, of course, transparency in information is very important. Firstly, to counter the misbelief of having very serious side effect arising from the vaccination, because there are now and then reports, very noticeable reports of people dying a short period after accepting a vaccination, and then many people will then worry that these are actually the effect of the vaccination. But whereas in fact, if you look at the figures released by the hospital authority, we actually know that the percentage of people who suffered very serious reaction or have serious diseases after receiving vaccination is actually lower than the normal population over a same period of time. And therefore, I think a very strong message must be given to the public that these vaccines are by and large safe and effective.
So everyone is very concerned about the resuming the cross-border travel. Do you think we have met the criteria of resuming the cross-border travel, especially with the mainland?
I know there have been very stringent requirement from various mainland cities and municipalities regarding that Hong Kong should have a zero infection record for a very long time before considering the resumption of people travel. However, I think internationally it is more and more accepted that we have to live with the COVID condition for a while, and therefore to have a absolute zero infection record to be maintained for a very long time is probably not very practical consideration. Instead, if we can achieve a very low level of number of new cases, especially for those with unknown source of infection, then I think we should have a case to be put to the mainland authorities that we should try resuming the people travel arrangement across the border. Of course, there should be some considerations such as whether we use vaccination record or whether we need a negative test result to be valid for whatever duration. All these details need to be agreed upon.
Right. So today there are over 370,000 of Hong Kong permanent residents now residing in the mainland, and that is around 5% of the overall Hong Kong population. And due to the pandemic and the travel restriction, the government have subsidized the University of Hong Kong Shenzhen Hospital to provide medical treatment for Hong Kongers who reside in the mainland. In your opinion, shall this be continued after the pandemic? And what else does the government need to do to expand healthcare services for those who reside in the mainland?
Of course, during the pandemic, this is a very needed measure so as to make sure that the fellow Hong Kong citizens who residing in mainland have the necessary venue to gain access to medical services and the medicine supply. But in the long run, I agree that these measures can be considered to be extended into the future as part of the arrangement to ensure the mainland residing Hong Kong citizens can get appropriate medical treatment, as well as considering the development in the Bay Area. The development of medical services and healthcare industry in the Bay Area is also a priority set by the central people government. And participation of Hong Kong healthcare industry is a key part of this overall development plan. And therefore, I think we can take the opportunity of these extraordinary measures during the epidemic and take it, extend it beyond the epidemic to be part of the initiative for Hong Kong and mainland collaboration in development of healthcare services and healthcare industry in the Bay Area.
So the government will introduce an amendment of the law for the medical registration amendment bill to introduce to open up the registration for those who are non-locally trained doctors who are also Hong Kong PR to come to Hong Kong and practice in public sectors. So do you think this will alleviate the shortage of doctors in Hong Kong?
Within my term of service in the Hong Kong SAR government, I actually also have been looking into the possibilities and means of various legislative amendments to improve the human resource situation in healthcare industry in Hong Kong. At that time, we looked at extending the contract duration and the approval period for non-local doctors who are employed by the hospital authority under the so-called limited registration provision. But seeing that this arrangement had not, in the short period of time, been very successful in bringing more local but non-Hong Kong trained doctors to the public sector in Hong Kong, then government see the need for introducing a separate piece of legislation to enhance the pace of recruiting overseas trained Hong Kong medical doctors to help out our situation. Of course, we have to see the implementation in order to be sure whether this will be very successful. But my feeling is that it would not be very effective given all these restrictions and conditions, because for an overseas trained doctor to be returned to Hong Kong, you need to be trained in hospital authority for a number of period, a number of years before you can be allowed the registration. So people have doubt about whether this arrangement have adequate attractiveness for overseas trained doctor. But I would take a more lenient view and ask the people to wait and see the introduction of this arrangement and see their effect before making a conclusion. But of course, at the same time, there is also need for government to enhance the training arrangement for all healthcare workers in Hong Kong, as well as for the hospital authority to look at the means to retain more healthcare workers within the system. Because on the one hand, you are seeking to introduce and recruit more people from overseas, but on the other hand, if you look at the situation, there is a very significant brain drain situation from the hospital authority, the public hospital right now. Every week I hear news about doctors or nurses resigning from the hospital authority and joining the private sector. So the HA must look into a more innovative means in order to retain.
So what exactly is the problem? Is the remuneration package or the stress in the public sector, or what can we improve? How can we improve the public sector waiting time?
I think it necessarily have to be a combination of all these considerations. On the one hand, workload in the public sector is indeed tough, and on the other hand, there are also various management issues raised by our frontline doctors. And then the development of the private sector to make it become a little bit more attractive for doctors and nurses in the hospitals is also factors amongst the many.
Right. So you have served as a member of for the medical council and the public have an impression that the council do not really take complaints against doctor very seriously, because everyone in the council are doctors, and there are concerns that the doctors might be harboring each other when handling these kinds of complaints. In your opinion, how can we balance the interests between doctors and patients?
Now, whilst I have full confidence in members of the medical councils being impartial and taking patients' interests as the most important issue in considering any of these issues, there is a problem of public perception that we need to address. And that's why even when I was working in the SAR government, I try to introduce more lay or non-medical members into the medical council and try to make it more transparent and more representative in terms of the interest of the patients and the public at large. So I think this is an issue that the government together with medical council should continue to look into by improving the efficiency in handling the complaint, by progressively improving the balance of medical and non-medical members in the medical council, so that people in Hong Kong would have more confidence in the medical council.
So we now change the topic to the voluntary health insurance scheme, which this is one of the many projects that you have been promoted when you were in the government. So I tried to find out some latest statistics for that. So as of the 31st of March this year, 2021, the number of the policy reached almost 800,000. So according to the estimate by an independent consultant before the launch of VHIS, about 1 million people will purchase the certified plan in the first 2 years of the implementation of the scheme. So how will you describe the effectiveness of the scheme, and do you satisfied about it on the numbers of the one who signed up for the scheme?
I think any target that we can set for the number of policies signed under this particular scheme would necessarily be a guesstimate. You know, I cannot see any very exceptionally scientific means to establish a goal target. But if you look at the number itself,
800,000.
800,000, right. I think it's not bad. But there is certainly room for further improvement, because in the design of this scheme, there are built-in mechanisms that we can actually review the take-up rate and adjust the so-called attractiveness to people, especially the young people. Because there has been various comments even before the scheme was implemented, especially regarding the attractiveness to young people. Because one of the most important attraction for people to sign up with this scheme, apart from the improvement in quality, is tax rebate. Whereas for people who have established their professional career and business career, etc., they may find it relatively more attractive because the extent of tax rebate would be more substantial. But for young people who just join the community as a worker, they might not be finding it very attractive, because the salary level, etc., is relatively low, and therefore the absolute amount of tax rebate will not be very high. But I think we have to educate and do more promotion to let the young people know that once you join it at a young age, there is a very significant advantage in that the insurance company cannot evaluate your risk once you have joined. They can only adjust your premium according to age. So that is very important. And secondly, the government can also adjust the degree of tax rebate from time to time if they think fit. So I think these are the further possibility to enhance the uptake of the voluntary health insurance scheme.
Yes, as the VHIS doesn't cover the pre-existing conditions for for that person. So that's why I think it's better, even better for young people who join the scheme in earlier age.
There is all the reason for people to join the insurance scheme earlier. Although in Hong Kong, you can say that we have achieved universal coverage for healthcare services because of the presence of the Hospital Authority and Department of Health, which provide medical services at very low charge or highly subsidized charge. So this is in essence, a very comprehensive coverage for Hong Kong people. But on the other hand, we also want the people to have more choices, especially for elective situations. And therefore, this is the area for our young people to consider.
Yeah.
Right. I myself haven't joined yet, and after hearing what you have shared, I'm going to share and promote to my peers.
Let me try to convince you after the...
Thank you so much. I'm convinced. Shall we also talk about Chinese medicine that many of us are very concerned about? And it is actually written in the basic law that Hong Kong shall formulate policies to develop traditional Chinese medicine to improve medical and health services. And there's a plan that a Chinese medicine hospital will be launched in Hong Kong in 2024. In your opinion, what kind of impacts is this going to do to the medical profession?
Indeed, the piece of land in Tseung Kwan O was assigned originally when I took up the position of the secretary for building a private hospital. But seeing the importance of taking a balanced measures in the development of public and private services, and the importance of the further development of Chinese medicine in Hong Kong, I changed the policy and converted the original piece of land for private hospital into the piece of land that now we have for the purpose of a Chinese hospital in Hong Kong. And later, before the end of our tenure, we obtained support from the Chief Executive to provide funding for the construction of the hospital. And I'm very glad, of course, now that the plan is going ahead, and it is awarded to the Hong Kong Baptist University the right to operate the hospital after it is to be constructed. The hospital, which is first of its kind in Hong Kong, is very important. Firstly, it can support the three Chinese medicine schools in Hong Kong, namely the Baptist University, the Chinese University of Hong Kong, as well as the University of Hong Kong's Chinese Medicine School, in the basic training for Chinese medicine practitioners. Secondly, it provides a setting where we can provide Chinese medicine service not only in outpatient, but also to inpatient. That would be important for situations like stroke rehabilitation, for patients who have a cancer and require hospital treatment, and for patients with chronic pain, etc. And I also know that the Hospital Authority and the Food and Health Bureau have added many more items of clinical services subsequently to the list. For example, infertility services, etc. So we went up with quite a handsome list for conditions which can be treated in a hospital setting in a Chinese medicine hospital. And at the same time, the hospital can also support clinical research projects, because previously it is rather difficult for the experts to conduct clinical trials without a hospital setting, because in a clinical trial you need a very well-controlled environment for all this research data to be valid. And last but not the least, the hospital can also be a base for further international development and to bring Chinese medicine upfront to the international arena.
It is very exciting to know that you, as a Western medicine practitioner, support the developments of Chinese medicine in Hong Kong. So thank you so much for your time, and thank you so much for coming to our show, Dr. Ko.
Thank you, Dr. Cole.
Thank you.
Thank you.